Having a baby is one of the most beautiful and life-changing experiences a woman could have. But many of them will say that postpartum is also one of the most difficult experiences they ever go through in their life. Joining us now is Sandy Artinian, DOHC's Maternal Nurse Educator. This is a bit of a somber and difficult topic. It's something that people maybe don't want to talk about or don't want to acknowledge. It's not the glamorous, exciting side of motherhood, but I think for moms to know, for partners and loved ones to know, we need to talk about it because it's important for people to know what a woman could really go through after giving birth. What are some of the causes of these different experiences that we're about to talk about?
The causes are unclear. We have some theories behind it. Some of the theories are hormonal changes. You're going through a lot of hormonal shifts after having a baby. There are risk factors if someone has a history of depression, and then the stress of caring for a new baby. And a lot of moms don't have a lot of support, so it's just them and the baby, and it's hard. And so sometimes that stress can trigger it. Having a baby, we talked, colicky baby, a baby that's hard to soothe, can be really hard on a mom and her moods and how well she can cope with it. A baby with special needs or other emotional stressors in a woman's life.
People talk a lot about postpartum depression, but I want to start with baby blues. You don't hear that maybe as much. What does baby blues mean?
Well, baby blues is where you are having these crazy mood swings. It generally starts up right after delivery. You'd be crying for 1 minute, going for no apparent reason. You might be laughing. You might have a little bouts of anxiety. It's just these mood swings.
Up and down.
Yeah, and they usually resolve after about 2-3 weeks.
But it could progress potentially into postpartum depression, which you might hear people talk about more. What is that specifically?
Postpartum depression is an actual depressive situation. We know what depression is. It's like that, where it's more intense. About 10 to 20% of all women would experience postpartum depression.
I'm going to stop you there. I just want to reiterate that for 10 to 20% of women. So that's not a small percentage.
No.
It doesn't mean you're weak. It doesn't mean you're crazy, that you can't handle it. 20%, that's a big chunk of women, even 10%, right? You're not alone in this.
Right, and so that's why we really want people to know. So some of the things that you might feel is the severe mood swings, prolonged crying. In baby blues, you'll have a moment of crying, but in postpartum depression, the crying is lasting longer, and you're not feeling, once you stop crying, you just feel dark. The difficulty bonding, you might have difficulty bonding with your baby, and I do hear that from moms. Withdrawing from friends and family, those kind of depression symptoms is what we see in postpartum depression.
There's another level which you definitely don't hear about a lot. I haven't, but you say it's psychosis?
Yeah, postpartum psychosis is very rare, but it can happen. And it usually happens within the first week after delivery, and it's severe depression, it's anxiety, it's panic attacks. It's actually thoughts of harming yourself or your baby. It can be hallucinating, it can be delusionary thoughts. So it's real extreme like that, and it's a dangerous, if those symptoms come up, it's dangerous and you do need help right away.
So for a partner, whether it's a spouse or the mom or a friend who's over, for any of those, whether it's baby blues, postpartum depression, or psychosis, postpartum psychosis, what are some of the signs they should look for to know to seek for help versus she's having a tough time, as any mom would, just within the first few days of bringing home baby?
That's a good question. For depression first, if she, with the blues, it clears up. Mm-hmm. With postpartum depression, it isn't. It's lasting longer. It's more extreme. So if you feel, if you're the family member and you notice the mommy's really struggling and not herself, and suggest to her that let's get some help, and the obstetrician, primary care provider can help. We can help. They can always call me, and I can direct them to the right resources. Okay. In the cases of the postpartum psychosis, that's an emergent situation, and we do need to get help right away.
And there is a lot of help, and we want to detail that. What are some of the resources out there for people?
So 911, because it is a serious situation, call 911. There's a crisis text line, text HOME to 741-741. There's a National Suicide Prevention Lifeline, and that you're dialing 988. There's the NAMI helpline. It's 800-950-NAMI, which is 6264. And there's a Postpartum Support International, and they will help with this, but also with postpartum depression, also with feeling of isolation. Just they're there. They're staffed with trained professionals, and their number is 800-944-4773.
Again, we put that all up on the screen there, and we're leaving it up for another moment because it's just so important to reiterate to everybody that there's so much help out there, so many resources. If you're a loved one as well, maybe just also, continue checking in on the new mom. I hear a lot of moms say it's so isolating. Everyone's so excited for the baby, and you look cute, the bump, everything, and then all of a sudden you're in this little bubble afterwards, and maybe you don't hear as much from people, or you just feel so alone because, as we previously talked about in other conversations, you do need to keep the baby in a little bubble for a bit, right? For its own, immunity and immune system. So I think it's just so important to also continue hearing, even through a text message from a girlfriend or a friend, right? You're doing a great job. We're here for you. When it's time to leave that bubble, please let us know. We'd love to meet you for coffee, or we'd love to come over, right?
Bring meals.
Bring meals, yes.
Offer to do housework, things like that. But so they aren't just alone. That's really good suggestions.
Great. Well, thank you so much again. We just want to normalize this. We make moms know it happens to the strongest moms. It happens to the best moms. All moms are amazing moms. There's no perfect mom. You're the perfect mom for your baby, and it's something that a lot of people go through. So we just hope they seek help if they need it. Thank you.
You're welcome.